this is really fantastic. For some of us of a certain age, I'm not mentioning no names, it's been a long journey around mental health. I can remember working for Mind back in the 1990s, and there was an energy there, and then the energy disappeared for a good 2 decades. But you know what? The energy's back again. I just want to acknowledge all those young people, not the elders because you've had the acknowledgement already, but for the young people under 40. I said under 40. I just want to acknowledge all of you. I want to acknowledge all of you because, you know, we've passed the baton on to you, which is really important. I was asked to talk about hostile environment. As you know, I've been involved in the hostile front of window scandal, but earlier on today I was at the, African Remembrance Day, yeah? It's about acknowledging what happened to our ancestors nearly 500 years ago. So to me, the hostile environment didn't start with legislation 10, 20, 30, 40 years ago. The hostile environment started when we were captured and enslaved. That's when it started 500 years ago. And since then, we've been trying to fight for our humanity, our dignity and respect. And every so often, that dignity and humanity gets respected and acknowledged, but most of the time it doesn't. So that's why the battle of struggle and suffering, or sufferation, which is going to be in my next book I'm working on right now, sufferation, why are we suffering all this time? So the question around what we need to do, I think the manifesto is practical, it's realistic, it's been cost-proofed, has it? No, that's not. No, but the manifesto is important because now we have a new government. The government has already indicated they want to reform the mental health bill, which is great because the bill itself, there are some great amendments and changes in there, but one of the key things that needs to be sorted out is constitutional orders. That still needs to be resolved. But as you know, having legislation is not enough. As you heard from Shocker, it's about educating the community. It's about taking responsibility. And as you know, I chair an NHS organisation in Birmingham Solihull Hall. Work closely with Birmingham Solihull Hall Mental Health Trust. We commission them under the mental health care. But you know, the NHS is great, and one that we're proud of that. But we also know that the NHS is structurally racist. So one of the challenges that we have when you're working in the NHS, local government, the third sector, is for those black professionals and service users and carers, we've got to come together. We need to start creating our own spaces, our own institutions, alongside the mainstream. This is really, really important. So let's use this opportunity, this beautiful energy, this beautiful connectedness of the people here. Let's work together to do something special, because I don't know how you're feeling, but there are still too many of us in secure provision and in the criminal justice system. There's still so many of us who are suffering in silence in our homes as well as in wards. There's still many of us in the community who are traumatized by and triggered by whatever happens every single day in the media. You name it, every single day we've been triggered. We need to create those spaces and environments for us. So I just want to acknowledge the organisers, the team. Don't stop now, the work just started. Literally, the work has just started. Because what you're going to do now, and I've been working behind the scenes supporting you, we now need to convince the politicians and the lawmakers and key decision makers that black mental health matters, that black mental health is on the agenda, and we will make you accountable. It's all about accountability, yeah? So, I'm just finished on there because Yancy's just looking at me in a particular way. If you have the Yancy
I'm looking at you that way as well.
No, if you have the Yancy look and the net look, then you're in double trouble. So I just want to say, let's use this manifesto. Let's turn the dial on black mental health. Let's put it on the map properly. And why should we wait for someone to die in incarceration or a mental health ward or in the community for this action? Let's do it now. Thank you.